It's 4:30 p.m. here in Seoul. I'm Devin Whiting at the Arirang News Center, and we're breaking into our regular programming to bring you the latest briefing from the South Korean health authorities. We should be getting updates and a breakdown on the latest numbers, as well as updates possibly on the vaccination campaign and any new measures being taken to fight the virus. It looks like the briefing is going to start now. Let's take a listen.
Today's briefing will be provided by Mr. Son Young-rae, and we will also be providing sign language translation. First, we will hear from Mr. Son Young-rae about the current developments for COVID-19 and our countermeasures. It is February 28th, Sunday, and I'll start the regular briefing. As of midnight of today, in Korea, there were 334 newly confirmed cases. Yesterday, 8 people passed away. We pay our respect to the deceased and our condolences to the family members. From February 21st to 27th, for the past week, there were some developments, and I'll update you on it now. From February 21st to 27th, over the past week, on a daily average, there were 370 newly confirmed cases. And compared to the previous week of 455, this is about a 19% reduction. For the regions, there are still a lot of cases in the metropolitan area, and the resurgence is continuing. In the metropolitan area, there were 280 newly confirmed cases on a daily average, and this is 75% of the total number. For the non-metropolitan area, the daily average of newly confirmed case is around 90, so it is staying at a stable level, less than 100. For the metropolitan area, we have to make sure that the newly confirmed cases go under 200 to say that we are getting safer. And right now, it is still risky, and we can say that resurgence can happen at any time. So we want to ask the residents to be aware of such a risk, and please make sure that you are strictly following the disease control measures. The reproduction level of infection for the past week was around 1.0 for the entire country, and compared to the previous week, there was a slight decrease. And for the metropolitan area, the level is a bit less than 1.0, so we are seeing that the infection trend is getting a bit better. However, when we look at the trend of infection, we are seeing that the infection is spreading in many different areas. First of all, there are a lot of infections happening in business sites, and we are seeing the cluster outbreak, especially in places like call center where the place is confined and crowded. And also, we are seeing local infection in areas such as restaurants where people are having gatherings. When we sum it up, we do not see a massive outbreak or another resurgence of third wave. However, we are seeing a stagnant increase in the number of newly confirmed cases, which is remaining at around 300 to 400 level. So if we become complacent even by a little, we would see another big surge, and therefore we have to be especially careful at the metropolitan area. We want to ask our citizens to cooperate with us so that we can see a big decrease in the number. Next, I will update you on the current situation for the long-term care facilities. Long-term care facilities have a lot of senior patients, and therefore it is especially fatal when there is a cluster outbreak. Therefore, in order to manage this facility, the government has made it so that the staff members of long-term care facilities have to mandatorily be tested at least once a week and twice a week for the metropolitan area. For the non-metropolitan area, depending on the situation, people can be tested once a week and not twice. And by employing such a method, we were able to find around 50 patients in advance, and we were able to isolate these patients. And therefore, this led to a decrease in cluster outbreak in long-term care facilities. Cluster outbreak in long-term care facilities has decreased from 15 in December to 9 in January and 4 now. And also for the size of the infection as well, it used to be around an average of 74 in December. However, since January, we have seen a decrease to 21 per site. And with the vaccination starting in the long-term care facilities, we will make sure that we are continuing with strict monitoring of long-term care facilities until people become immunized. We are going to have one-on-one matching so that we watch out for people who are wearing masks to make sure that people are wearing masks. In addition, there are care facilities with a lower number of advanced testing, so we're going to make sure that we're monitoring them more frequently. We're going to make sure that we finish with the vaccination, and we're going to monitor the facility until people all become immunized. And we want to ask people who are working in the long-term care facilities to cooperate with as well. Starting last Friday, COVID-19 vaccination started. Now we are targeting the mass immunization, and we are targeting November 4, and we are starting on a long journey. We are vaccinating AstraZeneca and Pfizer, and many people have already been vaccinated across the world, and safety has been clinically and academically proven. Until yesterday in Korea, across the whole country, around 20,000 people have been vaccinated, and for the symptoms that were reported, it was at a bit of a mild symptom. So we want to ask our citizens not to spread any rumors to induce fear, and please don't trust them either. The government will be providing public news, and we want to ask you to trust them only. Please make sure to think about your safety and the safety of your family members, and actively participate in vaccination. Even when vaccination starts, immunization actually happens in a stepwise manner, so it will take some time for us to see the effect of it. Dear citizens, even after being vaccinated, please make sure to strictly follow the measures on social distancing and disease control so that we can curb COVID-19 fully. We have to make sure that the spread is controlled fully so that we can go ahead with vaccination without any issues. As it is getting warmer, and with the holiday coming up, there is the trend of increase in movement, and this could lead to increase in infection as well. Due to the easing of the social distancing measures, there are active operations of many business sites, and we are seeing an increase in cluster outbreaks in areas like restaurants and saunas and institutions as well. So to the users and also to the owners, we want to ask you to practice frequent personal hygiene, such as wearing face masks and washing your hands and ventilating frequently. For those places where these disease control measures are not followed, there is a higher risk of infection, and these are actually frequently being repeated. Tomorrow is the March 1st holiday, and for citizens who are planning to have gatherings, please make sure that you refrain from it. So this can lead to a case of many people from different areas gathering together, and this increases the risk of infection. And if people were to shout out together or to chant together or if to have meals together, those are very risky activities. So if you are planning on having gatherings or protests, please make sure to prevent from having any. And especially for the metropolitan area, it is especially risky. So if you're going to have any rally, please make sure to keep safety. And please make sure to also refrain from shouting or chanting where everyone is shouting together. And for meals, please make sure to refrain from having group meals as well. You have to make sure to avoid it. So we have to make sure that the spread is not resumed as we saw in May and August. The government will also make efforts and cooperate together so that our citizens can go back to and resume their normal lives. And we're going to make efforts for vaccination as well. Thank you.
지금부터 질의응답 시간을 가지겠습니다. 브리핑은
And that'll conclude our coverage of this briefing. Thank you for watching. Arirang News will be back at 6 p.m. Korea time.
Variants of COVID-19 are already spreading.
Limited protection from the